Hi, everyone. Today, I'm going to speak about a therapy that's somewhat new to the United States, and it's called intermittent hypoxic training. And this is where you're lying in a zero gravity chair and you're wearing an oxygen mask, and you're hooked up to a machine that cycles you according to the training coach through cycles of normal oxygen to mild hypoxia and then back. So a person normally does 4 sessions of normoxia, hypoxia. And the duration of the hypoxic session portion of the session varies according to your level of health and fitness. But the data on this therapy is extraordinary. And I got to invite some scientists in from Europe over the weekend and learn about all the studies that have been done on this throughout multiple decades. Most of the work has been done in Europe. And this type of training is like a kind of induces adaptation in the human body. In fact, in 2018, 3 scientists jointly received the Nobel Prize for understanding what mild hypoxia does to the body. So mild hypoxia will trigger the release of something called HIF1 alpha, which stands for hypoxia inducing factor alpha. And this in turn will trigger the expression of over 100 primary genes, which will code for products that will then trigger the expression of multiple secondary genes. So what this will do is enhance coupling of oxygen to the first enzyme in the mitochondrial electron transport chain, which is how the mitochondria transform oxygen and glucose into ATP. So this first step where oxygen is associated with an enzyme is enhanced by this therapy. HIF1 alpha will also trigger some genes that will raise the level of something called erythropoietin, or EPO. EPO will cause the bone marrow to make more red blood cells and enhance the oxygen carrying capacity of the blood. It will also trigger the release of growth factors that will lead to angiogenesis, or sprouting of new capillaries for enhanced delivery of oxygen into the tissues. And really, so what's the bottom line? Like, what do you get out of this? Not only do you have enhanced cardiorespiratory performance, where you are fitter and able to perform better in athletics, but it enhances almost every health condition. And I actually mean that. So it's been studied in robust, good quality studies to help cardiovascular disease. It's been shown to help chronic obstructive pulmonary diseases, bronchial asthma, even allergic conditions, peripheral neuropathy, age-related memory loss, neurodegenerative diseases, and the list goes on and on and on. And one of the most exciting areas of research is in the area of metabolic syndrome, which I've talked about many times before on social media, because it's at the root of your risk for so many diseases and rapid aging. And that's where, if you got metabolic syndrome, it's just taking more insulin to control your blood sugar than would be ideal because of insulin resistance. And the insulin goes to the liver, causes the liver to make more cholesterol, goes to the kidneys, causes the kidneys to retain salt and water, raising your blood pressure, and goes to your fat cells and causes you to put more fat in your fat cells, particularly around the middle. Well, it turns out that going through about 30 sessions of intermittent hypoxic training, which, by the way, is a very pleasant process, will cause reversal of metabolic syndrome. just doing that alone. In fact, I got some cases reported to me over the weekend of people losing 17 kilograms. So that's in the order of, 34 pounds of fat mass by doing just 30 sessions of this therapy over 3 months. So it's really extraordinary what you can accomplish with this. And who knew that this was such an important tool? But it's addressing cellular energy production. So it kind of makes sense. Like, you enhance cellular energy production, it's going to enhance your metabolism. The other cool thing it's been shown to do is that there are independent mechanisms for causing glucose to leave your bloodstream and go into the cell that are non-insulin dependent. I didn't even know that. So basically, there are almost separate channels called GLUTs, GLUT channels that when turned on will allow glucose to leave your bloodstream and go into the cell where it's needed for energy production. And this therapy enhances that. So extraordinary. The scientists also presented research, which I couldn't believe, on fertility in men and women. The therapy has been shown to, for example, increase sperm counts in men. And then not only fertility in women, but also the likelihood of a healthy pregnancy. So doing this therapy before pregnancy has been shown to enhance the health of the placenta during pregnancy. And the data on it is extraordinary. And I did not know that in Europe, like in Russia, every time a woman gives birth in a hospital, there is a sample taken of the placenta. And it's looked at under the microscope, and histology is done on that sample to look at the cellular architecture and the health of the placenta. And then that data is stored over time. So there's a record of what your placenta looked like when you were in utero, even later in life when you're an adult. And the healthier the placenta now, it's been linked to lower risk for developing diseases later in life. It's extraordinary research. They've done enormous retrospective studies on adults where they've looked at, adults and their propensity to different diseases, and then went back in time and looked at the original biopsy of their placenta. So anyway, the data is extraordinary. This therapy, which has been used in Europe quite frequently, for multiple conditions over time, even has historical origins in kind of like the spa culture of Europe that was usually up in the mountains, and different doctors that would take patients with various types of conditions up slowly to altitude, and historically showed that would help benefit children with asthma and people with various types of like allergic conditions that manifested as skin rashes and whatnot. So it has this kind of historical origins of just mountain spa medicine. And but anyway, this therapy is relatively new to the United States. It's taken off like crazy with Olympic athletes. And actually, this has some earlier origins as well. Back in the kind of like middle 1900s, there was an Olympic Games in Mexico City. And so the athletes that were at sea level knew they needed to acclimate to altitude in order to compete in the Olympic Games and compete well. And so they're really kind of that point developed, kind of like stimulated this altitude training with athletes all around the world. So anyway, since then, kind of the athletes have been in the know about the benefits of this therapy, but more from the standpoint of how it leads to enhanced athletic performance. But now we're learning here in the United States for the first time really how incredible this is for various types of health conditions and even just for healthy aging. So we're going to have the largest installation of this type of therapy in the United States in my new laboratory at JYZEN Labs. We're having a 6-chair room and really expert individuals that are, know how to safely guide people through this type of treatment. I had some sessions over the weekend and I found it to be incredibly comfortable and a really cool experience. And then in our room, we have a multi-dimensional, what would you say, an omnidirectional, that's a better way to say it, more accurate, camera that we're mounting on the ceiling, and we're projecting mountain scenes on the walls around you. So it's a really fully immersive, relaxing, meditative experience. And I highly recommend you come in and check it out at JYZEN Labs.